Hi, my name is Joshua and I will be discussing the hip adductors, the structure and function of them, their origin and insertion points, and the bones that they act upon. The hip adductors consists of 5 muscles, the first one being the adductor magnus, which is the largest of the 5, and is responsible for producing hip adduction and hip extension. The adductor longus, which has a triangular shape, and is responsible for producing hip adduction and assists in hip flexion. The adductor brevis, which is a smaller longus and deep within the longus, and is responsible for hip adduction and assists in hip flexion. The pectineus, a small flat muscle, which is responsible for hip flexion and stabilization with hip adduction as well. And the gracilis, which is a long and thin strap-like muscle, which is responsible for hip adduction and assists in knee flexion and stabilization. Now we will have to discuss the origin and insertion points of those 5 muscles, the first one being the adductor magnus. The origin is the inferior ramus of the pubic bone to ischial tuberosity, and the insertion is the linea aspera line on the femur and the adductor tubercle. For the adductor longus, the origin is the superior pubis, below pubic tubercle, and close to pubic symphysis, which is the center of that pubic bone. And the insertion is the middle third of the linea aspera and the femur. The adductor brevis, the origin is the lateral surface of the inferior ramus and the pubis, and the insertion is the proximal part of the linea aspera, the top part. For the pectineus, the origin is the pectineal line and superior ramus of the pubis, and the insertion is the posterior surface of the femur and inferior to the lesser trochanter. If you look at the femur right above the insertion point, there's a tiny ball peeking out, and that's where the lesser trochanter is located on the left side. For the gracilis, the origin is the inferior pubic bone, similar to the adductor magnus, and the insertion is the proximal medial surface of the tibia, which is on the knee joint as well, past the knee joint. The bones the adductors act upon are the femur, the pelvic bones, pubis specifically, the tibia, and the hip joints. Now I will be displaying an exercise for the adductor magnus to show it functions as more than an adductor, a stretch and strength-based exercise for the short adductors, and a strength and stretch-based exercise for the long adductor, the gracilis. The exercise I chose for the adductor magnus is the sumo deadlift. Different from a conventional deadlift, the sumo allows the recruitment of the adductors as they are being stretched when your hips are in a more abducted form and performing hip extension in the deadlift. The butterfly stretch is excellent for the short adductors as your knees are flexed, which allows for the gracilis, while still being stretched, to not be as primarily targeted as the short adductors, the adductor brevis, longus, and pectineus. This is because the gracilis crosses to the tibia, meaning the load is decreased when the knees are flexed, allowing for more load on the short adductors. Squeezing a ball adducting your hips strengthens your adductors as you concentrically contract those adductors, almost as if you want to crush the ball. Now that we want to recruit more of the gracilis, the long adductor, we must keep our knees extended as the muscle crosses to the tibia as mentioned before. A single leg lunge allows the leg that is not performing the lunge to stretch as that leg abducts from the midline. After discussing a stretch, a strength-based exercise now for the gracilis would be side-lying leg lifts, as you adduct your leg as in towards your midline as possible, fighting gravity.